Nama Wellness Community Center, commonly known as NAWEC in Mukono district, was founded by Komo Learning Centers in 2014 as a community-based organization running a private not-for-profit health center too, from 8 a.m. to 5 p.m., 5 days in a week. Our genesis began after a thorough assessment of the sub-county, which revealed limited access to health services, to quality education, and low socioeconomic status of the community members. The organization began by offering basic healthcare services using both facility and community outreach model, which was largely focusing on maternal and child health. So in 2018, the organization acquired a non-governmental legal status with a new strategic direction which focused more on health system strengthening.
The COVID period was a very challenging period for us as a facility because previously, way back from the time Nama Wellness opened, basically doing the basic care. We receive mothers during antenatal care, take care of them. When they reach term, or like 9 months, we refer them for delivery to the other health centers. But when the COVID period came in, it became a very big obstacle and challenge to us. We had high numbers of mothers attend antenatal care here, and then when time comes for delivery, remember during that time there was a total lockdown, so our mothers could not move. It was very difficult for them to move from their places of residence because we had women who came from as far as Mabuye, Kabembe, those very far villages. So they would either deliver from the traditional birth attendants or even deliver on the road. We had very many scenarios where women were delivering on the roadside, in the houses, in the taxis. So that's when we came up with a decision to start up with a maternity department so as to integrate the service in, to avoid referring them out, and also to prevent those 3 delays, which greatly contributed to the maternal mortality and morbidity by that time. Yes, so it was really so hard that when it came in, we were able to really get familiarized with the situation, and that was the beginning of our growth as a maternity department.
The CHW program was designed based on the Community Health Impact Coalition 8 principles, as well as the CHW AIM matrix. So this entailed that we had to work with CHWs who are recruited by the community, CHWs who are supplied so that they are active, accessible to the community members, CHWs who are comprehensively trained. We are glad that Ministry of Health came and trained the CHWs we are currently working with. We have invested in 100 community health workers, and we have seen that the impact is remarkable. These community health workers have actually visited over 369,000 households. They have managed children over 23,000 for diarrhea, for pneumonia, for malnutrition, and have actually made referral for complicated cases to the health facilities.
VHT be basawo abokukyalo abagattaganya abantu n'eddwaliro. Tukola emirimu ku kyalo kino mu byobuyonjo n'ebyobulamu n'okusomesa abantu ebyobulamu n'okubabuuliranga biki ebigenda mu maaso ku nsonga ya gavumenti okuva minisitule y'ebyobulamu nga tukubiriza abakyala ab'embuto okugendanga okunywa eddagala n'abaana okugenda okubagemesa n'endwadde ziba ziguddewo tubuulira abantu engeri gye balina okwetaasaamu endwadde ezo.
In addition to integrated community case management, the CHWs also go out into the community, treat women and girls for depression and anxiety using the interpersonal psychotherapy for groups or IPTG.
Kiki ekireeta ennyiiki? Kiki ekireeta endwadde ey'ebirowoozo? Tuyina ebintu bimeka? Bina byokka.
We have seen over 796 women and girls getting cured from depression and anxiety using this model. The program of community health workers is not a standalone, it is integrated, and therefore we've seen that it can bridge the gap between the community and the formal health system. The clinical outreaches can never be a success without CHWs. The Nama Wellness Private Not-for-Profit Health Center 3 is strong because of their unwavering support.
Wabununu gonero LC1 twasose wulira ku kizindaalo ne baddamu ne balanga ne batugaba abasawo batuuse. Obubaka obwembaweereza obusembayo bafeeyo nnyo okwekebeza, bafeeyo nnyo leeta bakazi baabwe okwekebeza ebirwadde bwe bityo n'abaana baabwe n'owerekerangako bakazi baabwe baleme balekerera.
Our strategic direction has shifted to health service delivery, advocacy and research to inform the national health policy.
Nama Wellness has supported us to run some of the health programs like immunization, health education of the masses. Nama Wellness is supporting us with human resources, especially there is their CAD, as we call assistant nursing officer, who is deployed in our health facilities in Nama sub-county. They have also supported us in areas of capacity building of the entire health workforce, especially on the new emerging diseases like at the time when we had COVID-19. I don't want to conclude without talking about the joint planning, which we are doing with Nama Wellness. We do this at the beginning of the financial year. And this is healthy because when you do joint planning, of course, we reduce on the issue of duplication of work. So we are carrying out most of the programs as a team. The organization has always supported the district.
Nama Wellness Center is one of the NGOs that we are dealing with as development partners in Mukono district in health services. We are ready and we always support them because government cannot reach everywhere. We are going for vaccination of the yellow fever. These people have already shown us their support. They are willing to change the lives of the wananchi in that sub-county and in the district at large. I remember when we had gone to Kome for a World AIDS Day, these people supported us by providing the condoms, the drugs, everything, and the knowledge to the people who are already infected with AIDS. And during the COVID-19, they were supporting. So the impact is totally seen, and we wouldn't love to lose them, and we wouldn't love to lose their support as government.
Begin our day with what we call the powerful beginning. We commit our day to God. We also pass on official communication, but besides that, we also stand by our colleagues through all the challenges that they may be going through. We are also cultivating the compassionate program where staff show compassion to their fellow staff, because if you're compassionate to your fellow colleague or staff during work, it easily extends to the service beneficiary.
Nalinga ndi lutonga nnumwa nagenda enama abasawo banyaniriza bulungi naye lwakuba nti nno nali nduddewo nnyo muleba nga balaba waliwo ekitali kituufu nga tebajja sobola kunzaalisa ne bampeereza e Mukono ku General Hospital. Neebaza abasawo akaseera ke baamala nange kuba abantu balamu bankolako bulungi buli kimu ekyetaagisa bakikola. Kuba buli saaviisi ebeerawo enteekateeka zonna eza gavumenti bazituusaako. Ne wabaawo pulogulaamu ng'ey'okugema, okukebera endwadde ez'enjawulo mu community, byonna babituusaako. Kati abasawo ab'ennama tubeenyumirizaamu nnyo.
Our future plan is to scale our solution to all sub-counties in Mukono district. Our core vision lies in providing quality and equitable health care services for all. Your generous support is critical in bridging the gap between our current budget, which includes a phased expansion of our comprehensive, affordable, and culturally acceptable community health interventions. It also includes the construction of our Center for Excellence Community Hospital on the land we just acquired from one of our supporters. Together, we can drive forward our mission by supporting our scale initiative and ultimately ensuring access to quality community health services for rural communities.
Njagala okwebaza nnyo Naweeki olw'emirimu emirungi gye tukozeemu naddala okutulabirira ennyo mu baana baffe abaali bakonzebwa ku byalo abakyala ab'embuto nebayambako bamaama baffe abazaala nga tebatuuse mu myaka nabo netukwasizaako twagala okwebaliza ddala bakama baffe bonna ebintu byonna bye batukoledde.
Naweeke kyetugisaba egende mu maaso tukyagyetaagira ddala mu Nama.
Naweeke koze omulimu munene era ngyebaliza ddala egende mu maaso.
Nama Wellness Bravo, we celebrate with you the 10 years and we are here looking forward to achieving many more years.
Thank you very much, Nama Wellness Center.
Congratulations to Nama Wellness Community Center for 10 years of impact. Thank you to our funders for the milestones we have achieved together. We have collaborated with our community since 2014 and still working with our community until. Thank you so much to the staff of Nama Wellness Community Center, the board that has been with us from the start, and those who have joined us up to now. We are looking forward to achieving our next 5-year strategic plan together with you. Above all, I thank our clients for the trust you have invested in us and still supporting us up to now. Congratulations on the 10-year anniversary celebrations.
Abasawo bombagaliza 10 anniversary ennungi.